Good evening. I am blessed that I get to talk in front of my church every month, and I tell you what, when you're talking to a bunch of people at church, they all like to talk and talk and talk, and the only way that I can get them in their seat and paying attention is if I start praying, then they all get real quiet. But I'm not going to do that here tonight, but I want to thank you all for coming to our first Stop, Look, and Listen Community Helpers Talk series. I'm Eric Bradford. I'm from Scott Valley Focus, and most of our Focus folks are here tonight. And this is something that we have been wanting to put together for the last 6 months or so, and Lisa Campbell got it all put together for us. And I would like to thank Siskiyou Telephone for putting the Wi-Fi available that allows us to do all these things, and they did that for free, and for the Community Center for allowing us to have a place in which we can get together and talk about these types of things. Our first presenter tonight is Pam Smith, and she's from Medicare, and she's going to be discussing P2A2 HICAP program. She is the program manager for, I don't know how big of an area, but it's large.
Shasta, Siskiyou, Modoc, Glasgow, and Trinity County.
Yeah, so pretty much no Del Norte. Are they on there?
No, that's PSA1.
Oh.
We're PSA2.
Yeah.
So they go by region.
Okay.
Yeah.
So let's give her a round of applause. Oh, I have one more thing. I'm going to be passing around a group list. If you're involved in a group, one of the things that we want to do, and I'll get into this more at the end, but if you're involved in a group that is community oriented, either from a church, from just a regular community or a government group, and you're part of that group and it can be a resource to the Valley, put it on this list as I pass it around. Thank you.
Thank you, Eric, and thank you, Scott Valley. The focus group out on my cheat sheet here, for inviting me. I really appreciate it. Every opportunity that HICAP gets to speak to, seniors and the community in our 5 counties, we always take advantage of that. Just because there's a lot of people that don't know about our services, which number one is free. We do not charge for any of our HICAP services, which is basically Medicare. That's our scope of services. Okay, and we are not associated with any insurance company, agent, or product. We're here as counselors and advocates for Medicare. Okay, so I like to always see who my audience is. How many of you are on Medicare now? Raise your hand. Okay, great. And for you who are not yet Medicare age, this is very good information for you, yet you're probably not thinking about that right now. But anyhow, just know that there is a program that's out there that will help you navigate and understand Medicare. Okay, so let me get my slideshow started.
Behind you if you need it.
Okay. Hold on. Come on. All right. So, who is or what is PSA2 AAA? There are 33 PSAs. One is Humboldt and Del Norte. 2 is HICAP, Reading, so Shasta, Siskiyou, Modoc, Lassen, and Trinity. Number 3 is Passages, and they're out of Tehama and Butte. And then it goes from there all the way down to 33, which goes down to Southern California. Okay, these are all PSAs are in California only. So we're by region or counties, and we typically try to stay within our counties, and we refer out to the other programs who, when a resident calls our phone number, we try to refer them to the nearest HICAP to them. So PSA2 means planning, service, area. The AAA is Area Agency on Aging. It's a lot. Okay, so we just say AAAs. As I mentioned, we are not associated with any insurance, just Medicare. Okay. Who is health insurance? We're a state-sponsored, volunteer-supported program, so we're always looking for volunteers to help, and we do the training. I do it myself, as a matter of fact. We have one of our volunteers here, Catherine Barish, and Catherine Stan. She is our newly registered counselor in your county, in your town. She lives in Fort Jones, so if you don't know her, now you've just met her. So thank you, Catherine. So we have one office in Reading, 3 staff. Right now we only have 2, and then the rest are all volunteer-supported program counselors. So if you or anybody else you know would want to give back to the community and learn about Medicare, then just send it my way, okay? We provide the free counseling to Medicare beneficiaries, those who are going to be soon eligible for Medicare. So even if you're a year out, you don't know what to do, you call us and then we schedule a telephone or in-person appointment and walk you through that whole process. We are unbiased, which means we cannot refer, recommend, suggest any insurance company when it comes to the Medigap supplements or even the Medicare drug plans that we help you with. Okay. We get our funding from state and federal. The state is California Department of Aging, and the federal is Administration for Community and Living. Who do we serve? Current Medicare beneficiaries, individuals who will be eligible for Medicare, adult children who are now having to take care of their older parent, and a lot of the adult children do not know anything about Medicare. So if they know about us or they find out about us, we help them in understanding what their parents need and have to review every year during Medicare's different enrollment periods. There's a lot of individuals under 65 due to a disability who have Medicare. They have a 2-year waiting period through Social Security office, and then after 24 months, Social Security deems them eligible for Medicare. So it's not just for people 65 and older, but it was reserved for that. And then we also community educators, so we work with those providers who work with Medicare in every avenue or the senior population. Okay. And then we also help with long-term care. We don't sell the insurance, we just help explain it. Okay. So I'm gonna kind of move around. Lisa, if you can wave your hand and let me know when I'm getting close to my time frame. So, okay.
That Lisa.
Okay, that Lisa. Okay.
Yeah, Lisa got the time.
Got it. Thank you. Okay, a quick look at Medicare. So in your county, and basically the other 4 counties, now there are Medicare Advantage plans and there is Original Medicare. You have that choice to choose one or the other and how you get your Medicare. Let me explain one thing about the Advantage plans. Okay, I really wish they would work. They work when they work and they don't when they don't. When they don't is when your provider will not take that insurance. And it seems to be in our 5 counties, there are very few where the provider accepts it and there's no issues. But the majority of Medicare beneficiaries who get into these Advantage plans, they get into them because there's 0 premium, 0 deductible. They have dental, vision, hearing, which original Medicare does not cover yet, we're hoping. And so, and then the other thing is they offer these discount cards that you can use for various things and purchases. And those are all great. Those are great benefits, but what good are they if when you finally go to use that insurance for medical services, your doctor says we don't take that? And it's happening a lot and more frequent. And during this upcoming annual enrollment period, and now these, I don't want to say they're all insurance agents and brokers, but they're heavily marketing these Advantage plans. All I ask you is to make sure you check with your provider before you switch your insurance, okay? And make sure that they accept it. Okay, so I'm just going to run over the parts of Medicare. There's Part A, B, C, and D. That's just the Medicare portion. Then there are Medigap supplement insurance that are also lettered. Do not be confused with the letters of Medicare. I'll go through each one. So basically, Medicare Part A covers your hospitalization, okay? If you have, if you're admitted into the hospital, there is a deductible that you have to pay. It's $1,632. That's your first out of pocket, and then Medicare will pay the rest of your inpatient services. Now, there's also observation. Doctor puts you in the hospital to observe you. You're under observation status, not admittance. And so if you don't have Medicare Part B that covers outpatient, then you have to pay 100% instead of 80% out of pocket. So this insurance should not be confusing like this, but it is. And our beneficiaries are all over the place with bills and not understanding, and that's where our program comes into play. It might be after the fact, and we try to have to, try to problem solve, but for the most part, we're there to help, okay? Now, Medicare Part A has no premium associated with it. That's because if you've worked your 40 credits with Social Security office, they deem you as getting Part A free. That's where your FICA taxes and your other taxes, Social Security and disability that come out of your paycheck go to. So there's a lot of people who don't get Part A free, and they have to pay a premium if they want that coverage. Part B covers your doctors, your labs, your x-rays, outpatient, durable medical equipment, and this one does have a premium for everyone. Unless you're on Medi-Cal, the state, and you are eligible for it, the state will pay your Part B premium. The premium this year is $174.70. Most people get that deducted from their Social Security check. But there is a program called the Medicare Savings Program that if you get screened for and you're eligible, you could be apply with our assistance, and the state will pay your Part B premium, and then you'll get to keep that, okay? I already mentioned what Part B covers. Now, Part C is also known as that Medicare Advantage plan, the one I was talking about earlier that we wished it would work in these counties, but it doesn't because the doctors don't accept it. That's Medicare Part C. Where's my D? Okay, I missed D. Okay, I forgot to put my D in there. Anyways, Part D is your Medicare prescription drug coverage. That is a big one for our seniors, okay? Every year, Medicare allows you to compare your plan this year for next year, and it's coming up. It's October 15th through December 7th. Highly recommend, so does Medicare, that you review your drug plan every year. Doesn't mean you have to save it. That you have to switch. It means that we can help you save costs if there's a better plan for you in 2025. I do not have any information on that because those plans are not made public until October 1st of every year. But you cannot enroll until October 15th through December 7th. I have a sign-up sheet in the back on the table that you can sign up with just your name and number, and we can call you and schedule you an appointment during that window for Catherine. Okay.
Where's Christine? Right here. Okay.
Okay, and then lastly, Medicare covers 80% of your services under A and B. Your drug plan is totally separate. They're called standalone prescription drug coverage because it stands all by itself. These supplements work with Medicare A and B only. There are 10 standardized plans sold through private insurance companies. We help you to understand what each plan covers, and then we will do a sample rate, and then you decide which plan you can afford, and then you enroll directly with an insurance company. Okay, that gives you basically your full coverage in Medicare. A, B, D, and a supplement. Now, if you have a retiree plan, that serves as your supplement plan if it has a drug coverage in it, or the state Medi-Cal program is also your secondary. If you have VA, VA works differently. It's not who pays, it's where you get your services determines who pays. So we have a lot of veterans who are all over the scale as to, do they need Part B, do they need Part D? So that's really up to the individual whether or not they want to purchase that extra insurance. These are, can't really see it, but here's the standardized plans. Where you see a check mark, that plan covers that benefit, and where you don't, it doesn't cover. And then here's two more. Okay, so there's Medicare that works with other insurance. There's the employer group health plan for those who are still working. Typically, they should only sign up for Part A because they have drug coverage and medical coverage through their employer. CalCobra or Cobra doesn't really work with Medicare, and if you don't understand how that works, then you could potentially end up with late enrollment penalties. Retiree plans, as I mentioned, are secondary. VA benefits, TRICARE for Life, individual health insurance, and then Medi-Cal. The Medicare Savings Program is the one I was talking about. If you're eligible, you could have the state pay your Part B premium, and you get to keep that in your pocket. There's also the low-income subsidy program. It's called Extra Help. That one only works with your medications. If you're eligible, now did I update this? 23, no. I have not updated, but you could potentially, a person who's eligible for both Extra Help and the Medicare Savings Program, the value of those two programs together as of last year, 2023, is $7,278.80 that you could potentially save, okay? And we also help you with that Extra Help to screen you for that. Medicare, if you're not taking advantage of it, Medicare Preventative Services. These are services covered at 100%, not 80%, if your doctor's contracted with Medicare. And how do you know if they're contracted? You simply ask the girls in the office, or your doctor. And if they are contracted, you would only have to pay 100%. I mean, you wouldn't pay anything. It would be covered under the Medicare Part B at 100%. So, did you all know about these preventative services under your Medicare? Yeah, a lot of people don't know that. Okay, so talk to your doctor every year and ask them. There's a list in this brochure, and there's a little small mini one on the table that you should talk to your doctor and find out if there's any of these services, services that you should be taking advantage of. Okay. We also get a stipend to educate our seniors on Medicare fraud.
Could you go back
Mm-hmm.
and see that there was one, says well, just with.
Yes. So new to Medicare, beneficiaries who are new to Medicare get a welcome to Medicare preventative service, okay? And then each year thereafter, you get a yearly wellness service, okay? Now apparently the doctors are all different on what they determine or how they determine the services and when. So Medicare has no specific time. It's not like calendar year. What I understand it to be is from some of the beneficiaries I've counseled is that if you got your first wellness benefit in October, they make you wait until October for the following year before you can get it. So it's always best if you're new to Medicare. It's kind of hard to say, I mean, when you can do it, because if you're new in October, there's not much you can do, okay? So you can also ask your doctor, can you change it to the beginning of the year so that I can go through and, we can talk about our preventative services. So HICAP also gets a stipend for educating our seniors on Medicare fraud. This is huge. It's not just Medicare, it's just fraud in general, but they take advantage of our Medicare beneficiaries. If they can access your Medicare card, the red, white, and blue card, they can use that to file claims with Medicare for braces, neck braces, knee braces, back braces, whatever, and charge your card against that. Now, if you later needed one of those braces and it was already billed to Medicare, Medicare will deny that. So it's very important that you should be looking at your Medicare summary notices. Do you all know what those are? You get them once every 3 months in the mail. It's a compilation of all of your services in the past 3 months. You get them 4 times a year, and you should just be scanning in there and making sure, oh yes, I saw this doctor, and for this benefit, etc. That's where a lot of fraud is detected. A lot of our beneficiaries either don't open them. I mean, this is them telling me what they do with them. They throw them away. So you don't want to be charged for services that you didn't receive, okay? So just scan through them and make sure. You should keep them for 18 months, and then you can throw them away because you're going to keep getting them every 3 months. So once the 18 months is over, you can throw them away. Mm-hmm.
So if you do have a question, you go to council?
Yes.
Okay.
Yep. You call, schedule an appointment, and we can help you problem solve it and find out what's going on. Okay. And did you know on those Medicare summary notices that if Medicare denies a service, okay, if Medicare denies a service, on the last page of every one of those Medicare summary notices, you circle the denied service, you fill out the back, and right below it is the third-party claims for Medicare. It's called Noridian in California. You send that to them, and you're basically saying, I am asking that you reconsider this denial. And once they do reconsider it and they do pay it, then they will send you another one and they'll say yes. But that's your first step of an appeal, basically. So anytime you see that denied service, fill out the last page, mail it to that address, and then you'll get a written response. And then if they don't, if they still deny it, that's when you call our office. Okay, as I mentioned already about looking for volunteers. Okay, right on time. And how can you find us? Here's a toll-free number. It recognizes it. The downside with this toll-free number is people who moved from a 530 area code to Sacramento and they call, they're going to get our office because it's based on the area code. So